In this video, we will be talking about the genomic analysis of COVID-19 as of March 20th, 2020. For the full report, please visit the NextStrain website. We analyzed 723 publicly shared COVID-19 genomes. By comparing these viral genomes to each other, we can characterize how COVID-19 is evolving and moving around the world. In this report, we highlight the virus has been introduced and circulating in many parts of the globe. Knowing if and to what degree COVID-19 circulates locally and how mitigation measures can slow the spread requires a good knowledge of the local outbreak dynamics. In this week's updates, we report that there is evidence for travel-related introductions to many parts of the world. The many places with recent introductions can expect to see cases expand in a 4 to 8 week timeframe. These places should start preparing now. Many places that have recently implemented social distancing measures can expect to see cases continue to accumulate in the short term, but new cases will likely plateau and decline in the medium to long term. Testing for both active infections and recovered individuals will be vital for coping with this epidemic. We currently have sequences from samples taken in 36 countries across 6 continents. While this data enables us to infer many useful characteristics of the outbreak and track its spread real-time, it's important to emphasize that our conclusions are limited by the availability of data. The map shows very few sequences from the global south. For example, we only have sequences from 4 of the 25 countries in Latin America where the World Health Organization reports cases of COVID-19. This is not because COVID-19 isn't circulating in these areas or that these cases are not as crucial to understand. Rather, we just don't have much data available for these areas. In other areas, such as the Netherlands, there is a vast amount of sequence data available relative to the total number of cases. So keep in mind that the size of each circle on the map indicates how much data is currently available from that area, rather than the true size of the outbreak. Sequence data can cross-check travel histories. Identifying where a given case was infected is important for understanding which areas are experiencing local transmission versus primarily travel-associated cases. Here, the tree is colored by the travel history of a case when known. Looking at the Canadian sequence in the middle, we see that they have a reported travel history to Europe. When we zoom out, we can see that this isn't always so consistent. Here, we can see that nearly all the cases reporting recent travel to Iran cluster together in the middle of the tree. Towards the top of the tree, we also see a Canadian case with travel history to Iran. However, this sequence doesn't group anywhere near the rest of the cases within Iranian travel history. It's certainly possible that this person was infected by a second ongoing transmission chain in Iran, but until we get more data, we can't confirm that this infection was travel-acquired. The virus has been introduced to nearly every country around the world. On the tree, we see lots of this kind of intermingling of samples from different countries. In fact, the World Health Organization reports confirmed cases in 159 countries out of a total of 195 in the world. However, not all introductions result in outbreaks. It may seem as though COVID-19 has suddenly exploded. For many people, this outbreak may have gone from an abstract concern in other parts of the world to something that severely impacts their daily lives seemingly overnight. But keep in mind that this has been brewing for a while. It's not necessarily that the virus is being introduced to new places more often. Most likely, many places are starting to become aware of localized outbreaks that were started by introductions several weeks ago. Areas that aren't yet aware of local outbreaks should prepare now and start surveillance testing. How do introductions become outbreaks? Sometimes these introductions don't result in secondary cases or localized outbreaks, especially if the index case is detected and isolated quickly. Many times, however, the virus spreads undetected through the local population until the outbreak reaches a significant size. Below is a thought experiment from Trevor Bedford showing how this is played out in Wuhan. On the y-axis we have space, on the x-axis we have time. The shaded area represents the number of cases. COVID-19 in Wuhan went from an index case in November 2019 to several thousand cases by mid-January, going from initial seeding event to widespread local transmission in the span of 10 weeks. We believe that international seeding events started to occur in mid-January. We have a critical 10 weeks from then to late March to contain these outbreaks before they become sizable. We can see a clear example of how an outbreak grows from data in Washington state. The root of the main clade shows that the virus was likely introduced to this area between the end of January and the middle of February 2020. Now, in mid-March, about 6 weeks later, we see that a local outbreak is in full swing in this area. From the sequence data alone, we estimate a doubling rate of 3 to 6 days, assuming an exponentially growing population. We can also see an example of how initially localized outbreaks seed introductions to other locations. The samples from Utah near the top of the tree, which is colored orange, nest within the main clade from the Washington outbreaks. This is consistent with the introduction from Washington to Utah, although it is also possible that there were intermediary steps in the transmission chain. Mitigation measures take time, but they save lives. There are likely many local transmission chains that we don't yet know about. This means that even for areas that just implemented social distancing measures, we should still expect case counts to grow over the next few weeks. These increases do not indicate that these measures aren't working. It just takes time for already infected individuals and possibly their household members to manifest symptoms, be treated, and recover. We also expect to see a bump in the number of reported cases as testing becomes more widely available. It is critical that social distance is maintained during this time. Controlling local outbreaks through social distancing is crucial to flattening the curve to prevent healthcare systems from being overwhelmed by many simultaneous cases. It also reduces the total numbers of cases and fatalities, and lastly, it allows time for the development of therapeutics and vaccines. Here are some steps you can take. Reduce the number of people you are in contact with each day, especially if you are in the vulnerable group. Remember that even if you're not super vulnerable, many people around you are. Follow these practices to protect others. Wash your hands like you just chopped a jalapeno and have to change a contact lens. Stay home if you're sick. Be prepared with a few extra supplies in case you need to self-quarantine. If you are an employer, encourage your employees to stay home when sick and financially support them to do so. Some other steps that officials can take are to make testing free and broadly available, put social distancing measures in place, and financially support those impacted by social distancing measures. We would like to acknowledge the amazing and timely work done by all scientists involved in this outbreak. We will report weekly updates on the Next Strain website.